Hello, everyone. I'm Professor Do Young at the Department of Nursing of Gwangju Women's University. This study was conducted with Professor Hong Young-nan, who works at the Department of Nursing of Suncheon University, and Hwang Jin-seok, who works at the Division of Mathematics and Big Data Science, Daegu University. The title of my presentation is an evaluation of impact on health-related quality of life in adult women. The table of contents is as follows. Let me first tell you the introductory part. Quality of life is a concept that encompasses all elements that make life valuable, and its importance has been emphasized internationally since the 1960s. However, despite the industrialization and democratization in Korea society, people's level of satisfaction or happiness with life is not very high. Quality of life, which is mainly used in the healthcare field, refers to the level of health in physical, mental, and social aspects according to the individual experience, beliefs, expectations, and cognition. There are various factors that have to be considered in terms of health-related quality of life. Comparing health practices to other variables that contribute to inequality, including money or socioeconomic position, shows that there is more room for reform. Smoking, drinking, and engaging in physical exercise are among the habits that fall under this category and have an impact on one's physical and mental health. Among them, depression is the representative mental health issue that has been dealt with in various health promotion policies, which the rate of women who experienced depression was higher than that of men and increased with time. In addition to depression, stress was also reported as an important factor that impedes health-related quality of life, and adult women are more likely to be exposed to various types of stress because they tend to experience changes and crises in life. Since most adult women are in charge of family health, the psychological health of adult women should be an important issue in the nation. Socio-demographic status such as age, economic activity, marital status, education level, and economic status were also reported as important factors affecting health-related quality of life. However, most of the existing studies on equality utilizing various tools have focused on individuals with chronic or special diseases or on specific population groups, such as adolescents or the elderly, but there are almost no studies for the health-related quality of life of general adult women in the community. Since earlier studies have also pointed out that the health-related quality of life of women was lower than that of men, it is necessary to comprehensively investigate the characteristic factors that may affect the health-related quality of life among adult women. The study examines the relationship between health-related quality of life in Korea adult women and their socio-demographic health behavior and psychological characteristics. The impact of late adulthood, post-menopause, low household income, and poor health status and health-related quality of life is investigated. Health behavior characteristics mark significant differences in smoking, drinking, sleeping, and physical activity factors. Psychological characteristics such as depression and perceived stress are taken into account to determine the quality of life. Preventive measures and support are needed for post-menopause women. Next, I'll present the methods of research. This is a secondary data analysis study to identify the factors affecting the health-related quality of life of adult women surveyed in the ACE KNHANES in 2020. In this study, utilizing data from the National Health and Nutrition Examination Survey, a representative national survey, the social demographic characteristics, health practices, and the psychological traits of Korean adult women were analyzed. The participants were informed that have they had been randomly selected as a sample household and were asked to voluntarily participate in the survey. Written informed consent was also obtained from the participants, and the total number of participants from 2019 to 2020 was 5,057 females who were aged between 90 to 64 years. We selected the data of 2,181 participants after excluding those with missing valuables. The subject's health-related quality of life was measured using the Korean version of EQ5D. The EQ5D is a tool to measure health-related quality of life by measuring overall health based on 5 multiple choice questions for exercise ability, self-management, daily activities, pain, discomfort, and anxiety depression. The total generates a score for health-related quality of life. The EQ5D index, after measuring the answer and applying weight to each question. In this study, the values presented in the NHANES were produced by applying the Korea Disease Control and Prevention Agency's weighting model. research instrument. Social demographic characteristics include age, income, education, economic activity, marital status, menstruation status, subjective health status, and subjective body shape perception. Among the items categorized were reclassified according to research purpose. Health behavior characteristics include lifetime drinking experience, drinking frequency per year, amount of alcohol consumed at one time, smoking status, moderate intensity, physical activity, working and weight training, and sleep time on weekdays. Among the items categorized were reclassified according to research purpose. In the case of depression, the Korean version of the depression screening tool. In the case of stress perception, the level of stress perception was classified into strongly feel much, feel a little, and hardly feel categorized. Statistical analysis. In this study, three different models were used in a multivariate linear regression analysis to investigate the variables connected to the dependent variable. The first model integrated social demographic information. In contrast, model 2 was extended to incorporate health behavior features and social demographics in its analysis. Model 3 took into account the social demographic, health behavior, and psychological factors to figure out the univariate association between category and outcome variable. We used F-test based on linear regression model. Also, we checked correlation to identify the univariate association between continuous and outcome variables. A multivariable linear regression model was employed for the analysis, and three different models were used in a multivariate linear regression analysis to investigate the variables connected to the dependent variable. The data used in this study was taken from the NHANES conducted in 2020 based on Article 16 of the National Health Promotion Act and our government designated statistics based on Article 17 of the Statistics Act. The survey data are open to the public and can be downloaded for research purpose after obtaining an ID and password from the NHANES website. Results. Now I will present the results of the study. The results for the health-related quality of life concerning the socio-demographic characteristics show the differences in mean variable for age, household income, education level, economic activity, marital status, menopause status, subjective health status, and subjective body shape perception were not large but statistical statistically significant. Notable differences are seen in the average health-related quality of life ratings concerning an individual's lifestyle attributes. There are statistically significant variations found in the following areas: frequency of drinking, amount of time spent working during the week, and amount of time spent sleeping during the workday. These results imply that the perceived quality of life about health is significantly influenced by these lifestyle variables. Moreover, while looking at aerobic activity, it is shown that those who did not participate and had a lower average score than those who performed aerobic activities. It's crucial to remember that this difference was not statistically significant. This suggests that even if there could be a numerical difference, it isn't thought to be statistically significant for this investigation. A deeper comprehension of the complex interaction between lifestyle factors and health-related quality of life is made possible by the careful investigation of these variables. After evaluating participants' health-related quality of life, depression, and perceived stress, the results show that the participants' health-related quality of life level was 0.97. The mean score for depression was 2.76. Remarkably, 22.70% of the individuals had a score of 5 or higher on the depression scale, indicating a spectrum of depression experiences among the research population. But the vast majority of subjects, accounting for 77.30%, reported a score of 4 or below. Conversely, the measured felt stress level was 2.73. The finding that the majority of participants, 56.91%, reported feeling a great dealing of stress is noteworthy. These results provide important new information about the prevalence and severity of depression as well as perceived stress levels within the studied population. Setting light of the participant subject experiences and mental health. In this study, for the correlation coefficient between the health-related quality of life and depression or stress perception, the quality of life and depression showed a statistically significant negative linear correlation, and the quality of life and stress also showed statistically significant negative linear relationship. The study was based on Model 1, Model 2, and Model 3. The results showed that there was no statistically significant difference in the average quality of life between individuals in middle adulthood and those in early adulthood, with late adult subjects having an average quality of life that was 0.02 points lower. The average quality of life was 0.01 points lower in menopausal participants than in premenopausal subjects. There was no statistically significant difference observed between individuals with mid-low, mid-high, and high household income. Instead, the respondents with lower household income and at average quality of life that was 0.01 points worse than those with a high household income. For the subject health status, the average quality of life of those in normal and poor health was found to be 0.01 and 0.05 points lower, respectively, than that of those in good health. The quality of life of those with depression was found to be 0.02 points lower than that of those without depression. Lastly, the average quality of life of those who felt strong stress was found to be 0.02 points lower than that of those who hardly felt stress, whereas those who felt much stress and who felt a little were 0.02 and 0.01 points, respectively lower than those who felt little stress. Discussion. The study was carried out to determine the level of health-related quality of life among adult women and to investigate how socio-demographic characteristics, health behavior characteristics, and psychological characteristics affect their health-related quality of life. The results showed that the average score for health-related quality of life as assessed by the EQ5D was found to be 0.96 out of 0.1.0. In contextually, contextualizing this founding, reference was made to the 2015 National Health and Nutrition Examination Survey, which reported score of 0.97 for men and 0.94 for women. However, since the present study include only adult women between the ages of 90 to 64, excluding those over 65, the result may not to considered an improvement in the health-related quality of life of adult women from that in 2015. Further study for subjects of the same age may be necessary. The variables that showed a significant correlation to the health-related quality of life were found to be age, menopause status, household income, subjective health status, depression, and perceived stress. First, among the social demographic characteristics, the quality of life of those in late adulthood was lower than that of those in early adulthood. Previous studies also showed that health-related quality of life decreased as age increased, which was consistent with the results of this study. Therefore, there is a need to improve women's health-related quality of life. through education to improve awareness of menopause and appropriate health management according to menopausal status or symptoms. Among other socio-demographic characteristics, the health-related quality of life of those with high household income was higher than that of those with low household income, which is consistent with the previous study that reported that those with high monthly household income had a higher health-related quality of life than those with low household income. It was shown that the higher the level of subject health status, the higher the health-related quality of life, which was consistent with the results reported in previous studies, showed that the health-related quality of life was higher when the subject health status was higher. It was also found that although drinking and drinking amount are not the factors that affect health-related quality of life among the health behavior characteristics, the drinking group had a higher health-related quality of life than the non-drinking group. Also, the health-related quality of life increased as the amount of drinking increased. Nonetheless, since women get easily drunk or addicted due to less alcohol dehydrogenase than men, and the negative effect of alcohol was uh, such as breast cancer, heart disease, or osteoporosis can become serious. Care needs to be taken not to build a chronic drinking habit. The smoking group had a lower health-related quality of life than the non-smoking group, but smoking was not found to be affecting the health-related quality of life, which is consistent with the previous study. Despite these concerns, most of the anti-smoking policies target male smokers, and thus the development of anti-smoking policies and programs for women is urgent. Those who slept more than 7 hours on weekdays had a significantly higher health-related quality of life than those who slept less than 7 hours. But sleep did not appear to be a variable that significantly affected health-related life. Meanwhile, a previous study of adults over 19 years old reported that women had a higher quality of life when their sleep hours were extended. Therefore, there is a need for a policy and program so that adult women can maintain healthy lifestyle habits such as proper sleep management and appropriate exercise. Among the psychological variables that affect health-related quality of life, depression was found to affect health-related quality of life. This result was consistent with the results in previous studies that reported that higher depression resulted in lower life satisfaction. In addition to depression, it was found that the more stress one felt, the lower the health-related quality of life. This result is consistent with the results in previous studies for single men and women and for adults over 19 years old, which all reported that the uh, quality of health-related life was low when there was a lot of stress. Stress occurs when an individual is exposed to an event that requires adaptation or is placed in a situation that requires him or her to go beyond his or her abilities. It is one of the most representative indicators of an individual's level of mental health, as the rate of perceived stress among women between the ages of 19 to 24 and 25 to 34 was known to continue increasing. It is necessary to provide support so that adult women can appropriately cope with the various stresses in their life cycle, such as work, parenting, parent-child relationships, employment, and health problems. Conclusion. The present research examines the variables in influencing Korean adult women health-related quality of life, and it finds that these variables are complex and including depression, perceived stress, age, menopausal status, income, and subject health status. Interestingly, the study reveals substantial differences in health-related quality of life depending on these health behavior traits. Even though smoking, drinking, sleep duration, and physical activity did not emerge as direct influencing variables. This study is a nationwide survey that uses big data to identify variables influencing the health-related quality of life for a diverse group of adult women. The significant parameters included such as socio-demographic characteristics, health behavior traits, and psychological variables, offer a strong foundation for the development of targeted programs intended to raise the health-related quality of life for this population. It is prudent to acknowledge that some socio-demographic and health behavior characteristics limit the current investigations. Therefore, future research efforts should aim to incorporate a greater range of elements to further understand the complexity behind adult women health-related quality of life. It can be concluded that, of course, the strategies for in providing adult women health-related quality of life is needed. The primary emphasis should be on reducing depression and stress, together with the development of policies and initiatives designed to strengthen health management capacity and promote a healthy way of living. The study emphasized the need for specialized treatment and assistance, especially for adult women who are juggling low household finances with post-menopausal health issues. Thank you.